Today's topic is 3D digital puzzle assembly for amplified learning, a comprehensive and competitive self-learning kit. Please go ahead.
Yes, ma'am. Thank you for the opportunity. So I'm going to go into basic sciences and how we use 3D printing for basic science, anatomy, pedagogy for self-learning, especially by the tactile touch. So theoretically, if we see a framework today, there are so much theory that has been discussed, especially if you see the complex structures that we don't dissect, like the cavernous sinus or the circle of Willis or even the eyeball for the matter. We never get to dissect these structures. And when you refer textbooks, there are different textbooks showing different projections of the same anatomy, and for a neophyte it tends to get slightly disturbing or confusing as to what the real anatomical structures are. So that was the thought or the cognitive statement with which we wanted to approach this. And you can see again, if you browse circle of Willis or even eye parts of the eye for that matter, so there is not a single proper way or proper representation in two-dimensional learning. So can't we use 3D printing, which is very commonly done in ophthalmology, which is one that took ophthalmic fraternity by storm, to create simple basic science anatomical structures to make sure that learning is more cognitive. So this is the final 3D model that I have printed, which I'll be showing along with the circle of Willis that I'm having in my hand, and as well as the eyeball model. So the concept was, just like an engineer, can we have the models printed for touch, feel, as well as to know where the structures are. So I got this idea from the toys and puzzles that the children used to play, like they assemble structures and they learn for a cognitive learning. So this is how we went ahead and we start with the anatomy book, the Cunningham's, the Chaurasia, and we used a Maya LT software to create this 3D anatomy, because a lot of reading had to be done to get the angulations right, and Cura software was used to print the models. So because especially when we print a thin model, it is very difficult to print it. So this is a video where you can see that the circle of Willis and the cavernous sinuses, as I told, which are non-dissectable structures, were actually reconstructed in three dimensions, and a simple basic science structure was actually printed for the love of learning and to make sure that the learning is being more facilitated in a much cognitive way rather than more textbook related or in a more mugged up fashion. So we did print these three structures related to ophthalmology, as you can see here. So these structures are also printed in with real-time fundus images. So you can see Fab Excel printer and Fab X Plus printer was used depending on the structure size. We used polylactic acid was the materials that was used for printing, which is biodegradable. And I have one model in my hand. At the end I'll show the other models as well. This is the circle of Willis. After the printing, it comes in unicolor. We'll have to just make sure we spray it and make it more redder in color depending on the structures that we want to have elicitation. So this is the first circle of Willis 3D model, according to my knowledge, that was actually printed, because 3D printing was being used for so many things. But when we changed our shift towards basic sciences, there were many things that were not explored. And also, like a puzzle, you can assemble it, learn it, so that you'll know, don't need to mug up the anatomy. Even the eyeball models also, we can see that the sclera, the choroid, the retina, the anterior chamber angle, we have used as much as reality as possible. The anterior chamber angle, for the retina we have used true confocal fundus images. And this is the point. Can we really dissect these structures and learn it? And this was also validated, the 3D models. And you can see that, as I told about the coloring, every colors will have different adequate supports and so on. We can customize it every way. So every data of the patient, flecked retina with autofluorescence, infrared, any case that you have, retinal diabetic retinopathy, a fibrovascular band, and so on, everything can have their own case sheets, retinitis pigmentosa. I'll just show you. And we did put it into the population, that is the first year postgraduates. We did add a roadshow. We showed them these models. We took classes for them to know their feedback, and you can see that 97 users were divided into two categories. The satisfaction levels were analyzed with the pair t-test. Of course, when three-dimensionally, when they held a puzzle, the levels were much bigger. And it's not that without this they were not very satisfied. They were satisfied to 89.44%. But the p-value was quite significant, and it really made a difference, especially for a first-year postgraduate neophyte or even for an undergraduate. So we are open these models in our website for open access so that anybody can download this. Can I have the cavernous sinus? Yeah, so this is the cost logistics of it. We have made it very economical. So this is a cavernous sinus model that I am holding in my hand. So this is like a puzzle. So we just don't need to mug up structures. And you can see the circle of Willis model is 200 rupees. The cavernous sinus is 200. The eyeball is 1000 rupees. Eyeball. And it took 10 hours to print the circle of Willis, 5 hours for the CVS model, and 30 hours to print the eyeball model. So This was the prototype model of circle of Willis where we did not get the angulations correct. So we went ahead, and then this is the second model where we were able to get the angulations much better. And this is all cost effective because it's very fragile and it tend to break. But we have made sure we conquer this. So this is and we have also made sure we are also printing the anterior chamber angle structures and so on. So this is puzzle making, which is a very simple idea. The children do it with their toys. We just took this idea, and now currently we are working on validating a model which is more complex, where we can add all in one: the circle of Willis, cavernous sinus, the brainstem, the cerebrum, cerebellum, and so on. And so this, my dear friends, I feel will be the future of 3D pedagogy, because it may even benefit the undergraduate students as well, so that there is no cognitive blind spot. There doesn't need to be any mugging up there. And even the 3D eyeball model that we have printed, you can see that different structures have been printed in different diameters, so that they can easily be inserted. The lens is different, and inside the retina we have used thermopolyurethane material. So if you see in the retina alone, so any structures that you can put inside this retina, you can have any picture, and this material is not not plastic, whereas this is more squeezable. So this can be used even for laser training and whatnot. So any fundus images can be added onto it. Thank you for your attention.
This was presented in the midterm conference, and
yes,
you got
ma'am.
a prize also.
Yeah, I was awarded the prize. I did mail them regarding that whether I should present it here again, because I won the best paper in midterm. But since this is a more competitive session, they told me to present. Despite me winning the midterm, they told me to present here also.
Very good.
Yeah, because there was not a Rangacharya session or anything there, so they told me to present here. Yeah.
I loved the idea. I think it's excellent.
It's a wonderful idea. Yeah,
It's a
exactly.
beautiful idea. It can revolutionize how we teach undergraduates and postgraduates.
Yes, ma'am.
Both. And as all of you know, nowadays we have a lack of human bodies,
Yes, ma'am.
especially for undergraduates. There is a severe lack
Yes, ma'am.
of. So this can, make up for that
Yes, ma'am.
lack.
Yeah, three undissectable structures. Like, we wanted to focus more on neuro-ophthalmic anatomy.
I get it.
Yeah, ma'am. So we are making different prototypes.
It's beautiful. I think it's a very intelligent idea.
Thank you, ma'am. Thank you, ma'am.